Another really common issue that some children have is ear infections or ear pain. And there's a number of things that you can do for this. One of them is a kind of a stimulation of the ear that helps open up the eustachian tube. And I'm going to demonstrate how to do this. We have Lillian here who's helping me out. So I'm going to demo how to do this. And this is something that I usually recommend doing on a regular basis. When they're complaining of their ear, or they're like pulling on their ear or something like that, if you have an infant. You don't have to pull very hard, but enough to make a little bit of a difference. If you just pull a tiny amount and just give a tiny tug that they don't even feel, obviously that's not going to do any good. Our goal with this is to basically pull on the tissue of the ear enough to where it opens up the eustachian tube so the inner ear drains. And so what you do, thank you very much, is give a little tug, and I'll move my hand back here so you can see a little bit better. I usually stabilize the face here, but give a little tug, and a little tug, a little tug up, a little tug forward, and a little tug backward, and you can feel that kind of pulling down into your ear, Lily. Yeah, and this isn't comfortable. We talked about this before the video. She doesn't like it, but it does work pretty good, and I'm giving a pretty good tug here. Now, especially with a little baby, you want to take it easy. Lillian's pretty tough, so I can yank on her ear pretty hard. And it's a little red now, obviously, but I gave it a pretty good hard pull. Usually you want to do this repeatedly, and it repeatedly kind of helps the eustachian tube kind of open up and drain. You never want to do it, obviously, hard enough to hurt the child, but this can help the inner ear drain into the throat through the eustachian tube and really help ear infections. So anyway, I hope this is helpful.